We are here for the third panel in the Pointing to Safety webinar series, Risk Management with Herbal Prescribing. And my name is Anne Marie Trioni, and I'm a licensed acupuncturist and an account manager for MIEC Insurance. And I am here with Ben Zappin, who is the co-host and a moderator, and the person that helped me put this series together. And Ben is from Five Flavors Herbs in California. So we were lucky enough to have 8 sponsors help us with this series, and I want to take a moment to acknowledge them and tell you a little bit about them. So as I mentioned, I'm from MIEC. It's the Medical Insurance Exchange of California. We're a medical malpractice carrier in Oakland, California, and we provide policies to licensed acupuncturists and physicians in 4 Western states: California, Hawaii, Idaho, and Alaska. As I mentioned, Ben is with Five Flavors Herbs. It's an herbal pharmacy online, and there's an apothecary in Oakland. Ben is a co-founder with his wife, Ingrid. And New Herbs is one of our other sponsors. Wilson, who is the president of the company, is one of our panelists today. They are a leading Chinese herb ingredient company, also located in California. CSOMA is the California State Oriental Medical Association. It's a professional organization of licensed acupuncturists and supporters of Oriental medicine, dedicated to the preservation, advancement, integration of the art, science, and practice of all branches of acupuncture medicine in the modern healthcare model. The AACMA is the American Association of Chinese Medicine and Acupuncture. They're located in San Francisco, and they work to promote legislation and benefit of Chinese medicine in California, and they provide resources for their members, such as an annual international conference on Chinese medicine. And this next year's conference is coming up next month on August 25th. AcuCare is a network corporation that credentials and lists licensed acupuncturists in preferred provider directories for medical insurance companies. They negotiate reimbursement rates on the members' behalf, and they are located in California and New Mexico. AOM Professional is a premier resource center of doctoral level hands-on webinar and distance learning modules in orthopedics, sports, and work-related injuries, chronic neuromuscular pain, and as well as safety and ethics. Anthony Vondermoel, who runs the organization, was a panelist in in our panels 1 and 2 in May and June of last month or two. Poca Tech is a 3-year master's level accreditation program in Portland, Oregon, and they approach acupuncture from a collective, cooperative perspective with the goal of graduates being prepared to serve their community immediately after graduation and licensure. They teach practical skill development for running and maintaining a community acupuncture clinic. Lisa Roedletter, who is the executive director, was also one of our panelists in May and June. And Maury West Seminars provides continuing education classes on bulletproof documentation and general and state-specific billing classes. In our previous 2 panels, we talked about how documentation is a key risk management strategy in providing support for your defense if you were to have a malpractice claim. So we highly recommend you check out her courses. The materials for the webinar are located on the website. You probably found that website by getting the link to the Zoom link. So there's also a button for the handouts. There's herbal guidelines, handbooks, regulations, and adverse event reporting links. There's also a link for offers from our sponsors, and there's also materials available for all 3 panels. We are recording this webinar, and we will send a notification out to all registrants and attendees. Please allow 7 to 10 days for us to edit and get that up. And the link will also be posted on the website. To obtain your continuing education credits, there is a link also on the website. Fill that out at the end of the webinar. We are providing credits for live credits. Distance credits are not available, and you must be present for the entire webinar to receive credits. So if you have questions, go ahead. Since the chat isn't working, go ahead and put them in the Q&A. And if I get the chat to work in the meantime, then I will put an announcement there. And we will be monitoring and addressing questions as time allows. And if you do have a question about a specific scenario, the panelists can only answer as much as it's not related to a malpractice claim. So our three panelists for tonight are Benjamin Zappin, as I mentioned, Wilson Lau, president of New Herbs, and we have a special guest, Bill Schoenbart, who's a clinician. And Bill, you've been practicing for over 35 years, is that right?
34 years.
34. He's an associate chair of the Department of Herbology at 5 Branches Medicine, and I'm happy to say that he was my first-year instructor for herbs a long time ago.
You were a good student. Got their mic on.
Somebody has their mic on?
Yeah, that's my dog learned to talk Chinese.
All right, so our agenda for tonight is we're going to divide it into 3 parts. The first, the panelists are going to each give a small presentation. Then there will be a section on Ben as the moderator will lead the discussion, and then we'll have an interactive Q&A with the attendees at the end. So we have several topic areas that we're going to go through tonight. The first one is developing literacy on herb-drug interactions. Also, guidelines for communicating about allergens, heavy metals, and pesticides. And we'll introduce a framework for safety, which includes good dispensing practices and guidelines for communicating known risks and evaluating dietary supplements. We'll also talk about adverse reaction or adverse event reporting and documentation practices. All right, so let me end this. And
You can even leave that topic up for a little bit till it's the next person's opportunity to share their screen.
Yeah, can you see? This is an opening up. Stop share. There we go. All right, Ben, are you there?
I'm here.
I can't, there you are.
Hey.
Okay, so I'm going to turn it over to you now.
Yeah, thank you very much for setting the stage and for all your organizational support of this whole program. For those of you who are here and haven't participated in some of the other workshops, they're available. And we'll be sending out links to you of all of the 3 workshops that built up to this. Great emphasis on the acupuncture profession in general. Guidelines for safe implementation of, acupuncture, moxibustion, therapies. And then this is it's really a survey class on some of the broader topics that we as practitioners, operators of herbal pharmacies, and individuals working within the herbal industry, the manufacturing industries, and the raw material industry are attuned to on a daily basis, and want to shed some light on some things that we concern ourselves with, so you don't have to, but that may be important for you to be literate in and versed in to communicate assurances to your patients about, the work that the industry has done to create a safe atmosphere, so that your patients don't have to be in fear. And then we want to shine a light on some things that we believe it's really important for you to remain vigilant about, be regularly in best practices, and also some critical thinking tools that are things that we always have to stay flexible and adaptable with, that are going to keep our patients safe. And also some things that we'll talk a bit about herb-drug interactions. We'll talk a bit about how to communicate with other referring practitioners. And as a bonus, this is something that, from my experience, literacy and herb-drug interaction and risk minimization has helped build my practice and help earn the trust of referring physicians. So can shed some light on that. I want to introduce our guests here, who both happen to be good friends of mine. I've known Bill for almost 30 years now, which means Bill caught me and spanked me when I was born. No, Bill was one of my first herb teachers when I started taking herbal medicine classes in Santa Cruz, California. They were all geared towards, this was through an organization called American School of Herbalism, where we learned Western herbal medicine and Chinese herbal medicine. We also learned a lot of pharmacognosy. We learned recognition of botanical raw materials. And this was also in Santa Cruz, California, where the herb industry is very strong. And so a lot of our teachers were pioneers in the renaissance of the American herbal industry in the 80s. And I started taking classes right after the Dietary Supplement Health Education Act passed, which allowed the industry to have a lot of agency and regulation. And so, and as a result of that, a lot of freedom to access herbal medicine. So Bill has been practicing TCM since '92, maintains a clinical practice in Santa Cruz, is associate chair of Department of Herbology at Five Branches University, where he teaches classes in Chinese herbal medicine and traditional medical theory. He's the author of 2 books on Chinese medicine, and he is also a current editor of the Botanical Safety Handbook and is an editorial reviewer for American Herbal Pharmacopoeia, both of which he'll be sharing details of today. He works as a consultant to the herbal product companies with the goal of providing sound advice regarding the development, manufacture, and maintenance of high-quality, safe herbal products. Also really tip my hat to Bill as somebody that I see continuing to study herbal medicine with a thirst for deepening and broadening his knowledge and continually applying it and practicing it and caring for people. So some respect there for you, Bill. And we'll hear from Bill shortly. Wilson is also a good friend and is a 3rd generation in his family to lead New Herbs, the leading Chinese herb ingredient company founded as a pharmacy in Oakland. Wilson grew up in an herbal pharmacy in Oakland, Chinatown, Drayling Tong, which is currently still run by his father, Henry. Everybody knows, loves, and knows. We provide TCM herbs originally by his grandmother, Dr. Bing Yin Lee's patients. He's actively involved in industry initiatives, including American Herbal Products Association. He's on the board of trustees and has held various leadership roles within that organization. And he's an ISO TC 249 US delegate, which we're going to ask you to tell us what that means, to help set the US position on a variety of international standards for TCM, working with a wide array of international delegates to develop those standards. Wilson participates in botanical sustainability initiatives in China. And when our company, Five Flavors Herbs, when the small business exemption was lifted, and any company of any size became obligated to abide by the FDA's CFR 111, good manufacturing practices rule of law. We stepped into American Herbal Products Association and said, just started showing our faces and started pursuing that law in our manufacturing. And Wilson was one of the people who really took us under his wing. And, this is a community of business associates, but also a lot of really good-natured mentorship happening. So Wilson's, in addition to being a friend, somebody who, has said, hey, you guys can do this. It's not as hard as some people might make it out to be, showed us the way in a lot of ways. So thanks for that, Wilson. Share a brief snippet about myself. I co-founded Five Flavors Herbs with my wife, Ingrid Bauer, as a herbal pharmacy, as an herbal liquid extract manufacturing enterprise. Once upon a time, we operated a brick and mortar store in Oakland, admittedly. But for the past 10 years, we've been a FDA registered contract manufacturing and herbal manufacturing company. So in addition to our own line and the extracts we provide through our herbal pharmacy, we're also manufacturing for several other emerging and established dietary supplement companies, and doing consulting and supporting high integrity, efficacious, clinically valuable herbal remedies through a lot of different channels. And in addition to that, I've been licensed as an acupuncturist for over 20 years now. Big area of emphasis of mine has been mental health. I'll talk about that a bit in our discussions. The format tonight is going to be, you're going to hear 8 to 10 minutes or more from each of us on a variety of topics that we hold as important. There'll be some prompts from Anne and myself steering the conversation. We'll have a more interactive discussion after we do our individual discussion presentations, and then we'll open it up to questions and answers. We're going to ask that people don't expect their questions to be answered while people are presenting and talking. We'll make time for that, so thank you for your patience. And Anne is going to be moderating us and spoon feeding us salient questions. I'm going to invite Bill to share his perspectives first, and we'll round robin a bit. So take it away, Bill.
Thanks, Ben. So I got into Chinese medicine really because I was interested in herbal medicine in general. I didn't really even know what acupuncture was, believe it or not. Then I found out it was really great. So I've done acupuncture and herbs for most of my career, but now I'm doing mostly herbal medicine. I'm also an expert witness for the State Board for Herbal Medicine. And I'll talk about a case later on that I worked on. Really, to me, the most important consideration for herbs is that you follow a differential diagnosis. If you try to use a Western biomedical framework to prescribe herbs, it'll never be as safe and effective as if you use a standard traditional Chinese differential diagnosis, and you're much less likely to have an adverse event. One thing that you can do, I tend to dose pretty high, but really, especially for a new patient that you don't know what they're like, best to dose low in the beginning and gradually pick it up. Because the most common adverse event in my experience is stomach upset, some gastrointestinal symptoms. So you can assess that and see how the patient responds by initially doing a lower dose. Then as far as general safety, of course, the safety is only as good as the things you're giving them. So you want to use reliable companies. To me, you can get a certificate of analysis, but those can be faked, and I'll show you an example in a minute. So really my guiding principle has always been, what are the ethics of the person that runs the company? So I know Ben's ethics, I know Wilson's ethics. They're dedicated to safe herbs, not adulterated, not high in heavy metals, pesticides, or in case of pesticides, none detected. And I follow that principle with all the companies I work with. Back when I was using a lot of Western herbs, I would rely on Herb Farm and Gaia because I know the owner's ethics and they're dedicated. I know they'd rather turn a crop into the ground than use pesticides. So those are the kind of people you want to work with. Now, then you've got what's called the Certificate of Analysis, C of A, and I'm not going to go into detail on that because Wilson's going to talk about that. He provides them for his raw materials. I do consulting for supplement companies, and I had one fellow, he was selling various Chinese herbs on Amazon, and one of them was black ant extract, which is not common for us, but it is used. And Amazon told them you have to approve that it doesn't have any drugs in it because it's used mostly in male potency products, and those have very frequently been adulterated with Viagra, or the main ingredient in Viagra, or Cialis, which of course it may work, but it's dangerous. And because people don't know it's adulterated, someone with low blood pressure could actually have a very serious adverse event from that. So I sent it out. I sent it to a specialty lab to test it for steroids and for pesticides, for drugs. But also I recommended to him that he just check the pesticides, heavy metals. And he said, that's not necessary. I've got a certificate of analysis. So I asked him to show it to me. I said, yeah, but you need to actually send it out. So we got it tested. Let me share my screen. I'll show you the result that came out. It's just a summary. Sharing is not turned on. Okay, Anne Marie, you've got to enable. Oh, it looks like it's sharing now.
No.
Can you guys see this chart?
Yes.
So basically the C of A that he was provided for the supplier, and this was just some random supplier he found in China, not certainly wasn't Wilson or someone like that who actually checks their quality. And this was the what the C of A claimed was in their product, 6.6 part per million arsenic. And the actual, after I sent it to the lab, was 33.7. So that's magnitudes higher. Cadmium was double what they claimed it was. Lead was triple. Mercury was way higher. So these types of fake certificate of analysis, sometimes it's called dry labbing, meaning they didn't really send it to a lab. They just fake the certificate and hope you take their word for it. So that's just an example. You want a certificate of analysis, but you want to get it from someone you trust. When I get a C of A from Wilson, when I buy bulk herbs, I know it's authentic. But this guy just looked up a random supplier and went for price, and it ended up being a dishonest supplier. I don't think he's in business still. I checked just to follow up to see before our meeting here, and I don't see that he's still in business. But I advised him not to sell it anymore. I don't know what he actually did with that. And then, you get a lot of students saying, oh, I went to Chinatown, I got some really good price on herbs. I said, well, do you know the owner of the store? Do you know who owns it? No, I just, I know what the herb looks like. So depending on the store, some of them have great quality. Some of them, they're just getting stuff from the wholesale market in China and sending it over here. And, there was a case where someone got some bulk herbs and it actually had untreated aconite foods in it, and, serious adverse event. So that was not a good supplier. So you want someone you trust, someone who has known ethics, and then the certificate of analysis actually will have meaning. Another thing is records are very, very important. Do I still have time, Anne Marie? Should I continue for a bit?
Yeah, go ahead.
Carry on, Bill. You have some more time.
Okay. In my work as an expert witness for the state board, I received a case, and I'm just for herbs. If they send me acupuncture ones, I refer them to Anthony or someone else. But in this case, it was a adverse event, a death that was blamed on herbs. So this acupuncturist had a patient and was keeping very, very poor records. Sometimes the record for the day just had one word or two or three words. And the patient that they were seeing ultimately died. So the state board sent me a stack this high of records, and I went through it, and the state investigators actually found some evidence that wasn't in the records that actually helped the clinician. So let me pull that up and then I'll share it just to show you what to expect from a state board investigation. Can you see this? Are you able to see this? Yeah. So
Yes.
I redacted the I got a bunch of thumbs up from the crowd, so I guess they can see it. I redacted the patient and doctor's name, but this was my report to the state board. So patient's death was not caused by nor hastened by the acupuncturist. The patient died from alcoholic hepatitis, which takes years to develop. Now I had to dig that out of numerous medical reports because as it was being presented to the state board, she got these herbs and she died. So the herbs given to the patient are standard formulas used to treat liver disease. I'll show you in a minute. They do not have a history of hepatotoxicity or adverse hepatic effects. And in fact, they have a long history of use in treating hepatitis, jaundice, and liver disease. Now, here's where I had to call the patient out because the state board has a very specific form. Did they do this? Did they do that? The practitioner did not keep adequate records. In fact, the herbal formulas are not listed in her patient records. So this practitioner was getting sued and the state board was considering taking away their license for an herbal adverse event resulting in death, and there were no herbs on the records. So that's a very big mistake. I'm relying on the investigator's report for the names and dosages of the herb formulas given to the patient. Despite this shortcoming, this factor did not affect the outcome of the case and did not contribute to the patient's death. The practitioner should not have advised against a liver biopsy if this in fact occurred. That's what it said in the investigator's report. But this had no effect on the outcome of the case and did not contribute to the patient's death since she got a biopsy anyway. That was a big mistake by the practitioner. In fact, according to the report, the acupuncturist advised the patient to go to the hospital. So I'll try to get through this quickly. So the acupuncturist didn't keep detailed records, which made it more difficult to assess than it should have been. Sometimes there were abbreviations that didn't have much meaning, but these are the actual records of the patient visits. Foot pain, digestion disorder, tired, hot flashes, night sweats. 2 days later, just said better. 2 days later, said same treatment. Better low back, feeling more of the tingling. Low back better, digestion sluggish. Feeling emotional, feet bottom tingling. Much better. Digestion problem, hot flash, night sweat. Liver disorder, yellow eyes, digestion problem, foot tingling. So right there, that's immediate referral. That's liver disease, obviously. Then the investigator's report indicates her note stated same treatment. It was in Chinese. Then on the 26th, very much tired and pain, send her to hospital with her mother. So this was a week after they had showed up with the liver issue. So I'm supposed to talk about recommended standard of care for the foot pain and digestion. I just mentioned recommended standard of care for foot pain would be acupuncture. The rest can be treated by acupuncture or herbs. There was no departure from standard of care. Then there's the one where it says patient had yellow eyes and liver disorder. So there was a follow-up 5 days later, noting the same treatment given. And then a week later, the patient was referred to the hospital. So I'm not going to go into all the details, but basically the symptoms pointed to the possibility of hepatitis or pancreatic cancer. And the investigators' records turned up the name of the formulas, Yinchen Haosan, Chaihu Shugansan, and Yigansan, which are all safe in alcoholic liver disease. So basically, she violated the standard of practice in regards to record keeping. So basically, my conclusion was, and I provided an appendix, each of the formulas, some clinical studies and how it's effective for jaundice and hepatitis for each individual formula as evidence that the herbs she gave were appropriate. So let me stop share. And then so the state ultimately did not take her license away. They made a condition that she attend a class on medical record keeping, and that was it. So, yeah, I hated saying anything bad about an acupuncturist, but I think I may have saved her license by supporting her treatment. Just it was very poor record keeping. And I'm sure we've all done incomplete records. You're in a hurry, you know the patient, but just points, especially, absolutely, you got to keep a record of what you gave the patient with herbs and which points you treated.
So I have a question or a couple of thoughts about how this pertains to some of our other questions, Bill. That, a big emphasis is documenting all of your communications. And, when you mention the recommendation to not go get a liver biopsy, that there's actual denial of recommendation, obstruction of further investigation or diagnostic investigation. That sounds like malpractice to me. And so, I think I really err on the side of caution. If somebody asks me, should I do this? That's not my scope of practice, and I'm not an expert. I want you to, and I'll document that. I want you to go and pursue this level of inquiry.
Yeah, that was a big mistake.
Yeah.
But the patient got it anyway. And after sifting through the records, I saw that her gastroenterologist commented the patient has a long history of alcohol abuse. The everything pointed to alcoholic hepatitis. So it was years in the making. So the practitioner, if anything, helped them with the herbs and treatment, but it was way too late.
Mhm.
Yeah, telling someone not to get a medical treatment after it's been recommended is never a good idea. You can ask your doctor about that. Is this really necessary? Is there another way we can do a test? You can recommend they speak to their doctor, but you never want to get between a patient and an MD. It's outside your scope of practice.
Mhm.
Did you do any evaluation, Bill, of the raw materials or the companies that the practitioner was working with to assess safety?
They were not on they weren't even in her records at all, but they weren't on the investigator's report. So basically, since she had alcoholic hepatitis, it was years in the making. It wasn't like she perfectly healthy, no history of alcohol. Suddenly her ALT skyrockets. She's got jaundice. That's a drug induced or an herb induced hepatitis. And that would have, been her fault if she prescribed the herbs and then that was the reaction. But in reality, the practitioner was not at fault. Just didn't
The etiology was extremely clear. Yeah.
Yeah. And Bill, I think one of the things is documentation is really important. If you look at my grandmother's, who's passed, trained traditional Chinese doctor, her records read like a book. And if you knew how to read Chinese, if you read her records, you would know how she approached different elements, and what her approach was and what tips you could learn from it. It's very clear, like this is a male, female, age range, issues, all this detail and richness that comes through reading these medical records of patients, anonymized, but just really clear about what she's seeing, why she's doing it, and what she is doing. So, if you look at a lot of the historical records of these famous doctors, that's how that comes about, is because it's meticulous documentation, record keeping.
That's great. Wish I could read Chinese. I'd love to see some of those.
And I think they're going to the museum in China pretty soon. Next time I come back, I'm gonna scan them and then drop some off.
That's great. Like the Shanghai TCM Museum.
There's a Minha museum outside of Shanghai, maybe hour and a half outside of Shanghai. She comes from the Minha lineage. So it's a unlike you, she doesn't believe in high dosage. She comes from a low dosage lineage, so that's why the quality of herbs are so important to her. It's really, low dosage plus bad herbs equals really bad results, and low dosage of high quality herbs, you get results.
It's great. I could just show the Botanical Safety Handbook briefly, or should I move on to something else?
Why don't you share that really quickly, and then we'll pivot to Wilson. We'll have time to circle back. And
Okay, let me grab that here. For some reason, it's not allowing it. Yeah, it's only allowing me to share documents, not the screen. So I'll just mention it. There's a link to the Botanical Safety Handbook online. It's also in print form. It's quite a weighty tome, but this is updated continually, and this, I believe, is at least 10 years old. Yeah, so 11 years old. So the online version is updated continuously. I'm constantly either revising ones that haven't been revised for 6 to 8 years, or I'm doing new ones that weren't in the book. So the online version is much more up to date. Eventually, the online version gets converted to a hardbound. So that once that happens, it'll be more up to date in the hardbound version. But the online version, you can look up an herb. There's quite a few more Chinese herbs in there than there used to be, a lot. And there's different classifications. So class 1, herbs safe for anyone. Class 2, some exceptions, like 2A would be not for pregnant, 2B, not for lactating, 2C, certain restrictions based on its possible toxicity, 2D, only for experts, and then 3, definitely only for practitioners because of the high level of toxicity. Then there's an interaction potential. There's, let me read it directly. So the interaction classes: Class A, herbs for which no clinically relevant interactions are expected. Class B, herbs for which clinically relevant interactions are biologically plausible. Herb C, herbs for which clinically relevant interactions are known to occur. So in the actual safety handbook, if it's just for example, let's say an herb induces or suppresses cytochrome P450, which is how drugs get metabolized, that would be in the pharmacology section. But if there is a case report where like for example, Eliquis is the newest blood thinner. We already know warfarin was very prone to interactions with not only with things that are metabolized by the same enzymes, but also blood-moving herbs could interact with it. But Eliquis is so new, I only found one actual interaction, and that was with large amounts of ginger. Ginger has blood-thinning properties. So if you can't find an actual clinical interaction in PubMed, in Medline, or in the Botanical Safety Handbook, you can actually do a search for what is the drug metabolizing enzyme for a certain drug. So it may be metabolized by cytochrome P450, 3A4, or 1A2, or 2D6. And then you can actually look and see if there's any studies, typically animal studies, sometimes human cells, on whether they strongly induce, strongly suppress, or just mildly. If something strongly affects the drug metabolizing enzymes, it's a likely candidate to interact with that drug, and you'd want to probably not give it to someone taking that drug, especially if it's a very dangerous drug or it's being given for a very dangerous disease. So that's
a note about that. Eliquis, you cannot check the INR and monitor the influence of the drug. And while it's considered more safe, that is one of the guardrails that we've been able to use in concurrent prescribing of herbs and blood thinners.
Up until recently, you couldn't reverse it if someone was in a car accident or had to get emergency surgery. Now I believe they do have a medication that can reverse it. But yeah, the only way you know if it's having a problem is you get a bleed. Nosebleed, no big deal. Brain bleed, big deal. So you definitely don't want to contribute to that, because if they have a bleed, guess what they're going to blame? The herb, and it may well be the, but even if it's not, then you're going to have a problem.
Yeah, and I was going to speak to this, that related topics of how to monitor, and you can do a very thorough lit review, as you mentioned, but I've seen individuals who didn't disclose that they were taking warfarin because I think there was a mix of denial, and it was a congenital case. They weren't an old person. They were somebody with a clotting disorder, and they were a man in their early 50s, and they thought, oh, I can go about my life. And I was giving them chaga jejitan for poison oak, and it worked really well. It really helped them. They kept going hiking with their dog and getting poison oak again, coming and getting more chaga jejitan, and it was a kind of over-the-counter care with somebody who presented as very healthy, still presents as very healthy. And at some point he said, Ben, do you think this could be interacting with my warfarin? I said, what? And I went back and I double checked every single herb in the formula, and there's no available literature. There's no, nothing is on the market enough that there's safety data present, and it's not a commonly reviewed enough or commonly in commerce enough formula to have a lot of data on it. But sure enough, he stopped taking it, was having his INR checked regularly, and that was determined to be the contributing factor. And so how do we set up guardrails clinically, document it properly, when one, people might not put that in their chart, and two, when there's not available literature for us to make clinical decisions by. It's an overarching thing to keep in mind.
Well, two comments on that. I'll be brief. You can do a search for individual herbs. You can do like, you got Chaihu, Huangqin, Shigao in that formula. You can do in PubMed, Chaihu and antiplatelet, or Chaihu and anticoagulant. And all the other part of the question, my initial intake form always has medications you're taking. And if it's not filled out, I ask them, you didn't put any medications in there. Oh, I forgot, or I'm not taking any. But once you put that in the notes, it's really not your fault if they're not telling you what they're taking.
Yeah, and this was really initially in the context of a over-the-counter.
Right.
I have poison oak. What can I take? And seemed like a reasonable thing at the time. That's how we learned. And we're going to pivot to Wilson for a bit to share his expertise. There's a few questions, Wilson, about certificates of analysis, which I know is one of the things that you're going to talk about. And I think to frame it, when we've stocked in herbal pharmacy, if somebody came, and because we also supply bulk extracts as raw materials to people who are dispensing, if people said, can I get a certificate of analysis from every single raw material you're vending to me? And if every one of our customers did that, we'd have to have a full-time certificate of analysis vendor. So what can that in mind, because I want you to not experience that encumbrance. How can people become literate? How can people supply or qualify? How can practitioners supply or qualify herb vendors, product vendors in a way that will have their ethics, their practices be transparent, what has New Herbs done? Those are some of my guiding questions for you.
Let me answer some questions first, and then I'll go into the presentation. I think it's important to qualify all your vendors, right? Like Bill said, he trusts us, but he trusts us but verifies, right? So he gets the C of A, he might even send it out for testing to sort of confirm. It really depends how meticulous you want to be about the process. But the reality is, if you order a lot of herbs, you get a lot of certificate analysis, you're going to treat them just like paperwork. Because if I need a full-time person doing it, you'll need a full-time person reviewing it. And that isn't really what you should be doing with your time. You should validate, and you should also occasionally update and make sure that the same practices are being upheld. So I recommend when you first start doing a business with a vendor, request some CFAs for review, make sure you understand what they're testing for, how they're testing, where they're testing, and sort of making sure that they dot all the I's and cross all the T's, including having, insurance, product liability insurance, because, just in case if anything ever happens, you want the company to have insurance fall back on, especially if it's not related to something you done, right? So I think that's very important. So you should have a checklist of what kind of questions you should ask them and what's the minimum standard they should be hitting, right? If they exceed it by a lot, that's even better. But every company should have their product liability insurance if they test. How are they testing? What they're testing for? And we'll sort of go over that when we talk about how to read a CFA. I love the answers about your comment about guardrails. I'm going to put the first guardrail up. I am a licensed attorney, so what I will be talking about today, none of it constitutes any legal advice. And if you do need legal advice, please contact your lawyer. So that's a guardrail, right, that we use as a lawyer. So I think as a practitioner, you really have to think about when are you acting as a practitioner and when you're acting not as a practitioner, but just using your expertise in that area. And that leads me to your scope of practice, a practitioner's scope of practice, and making sure you stay in that scope of practice versus when you go outside that scope of practice. And that's very important. You can check out a discussion I had with another dear friend of Ben and I's, Asa Alstein, who we did a discussion about when practitioners are practitioners and when they are herbal manufacturers or brand owners. And that comes to my regulatory overview, right? There's regulations that govern food, drugs, and cosmetics under the FD&C Act. And the one that we really are concerned about are two. One is the food regulations and the other is the dietary supplement regulations. And this is really when you are acting outside your scope of as a practitioner and you are, running a compounding pharmacy, have your own line of supplements or foods. So I think that's sort of what we're talking about. And the dietary supplements, GMPs is called the current good manufacturing practices, and is often referred to its letters, CFR 111, and then there's food 117, right? And what you're doing, if it's within your scope of practice, the FDA has said on numerous occasions, they will enforce discretionary enforcement. So they're not out to get you when you're doing one-to-one practices if it's within your scope of practice. But the second you start making hundreds of bottles and putting on your shelf with labels to sell, then you're no longer considered that on one-on-one consultation that Bill does and Ben does. You're really now becoming a brand that sells products. And the CGMPs will cover everything from how to make how to make your herbal product, what safety measurements need to be in place, what you're testing for, what quality is there. That's really what it's talking about. How do you make a safe, effective product, right? It's really helping you put some guardrails in place. If you're acting as a practitioner and within your scope of practice, what you really need to focus on is the good dispensing guidelines. I believe Anne Marie has included that in her handout and list of resources. And what those really entail, right, is cleanliness, right? Like you're not contaminating the products that you're selling and compounding or giving your patients. Secondly, is talking about traceability and record keeping. Like how, if something does happen, how can we say it wasn't our product, but it was something else, per Bill's earlier example, right? Like the person had liver disease, and as long as we could show you used the right formulas, the right formulations, and proper herbs, and the contamination didn't come from your side, you're able to reduce your risk and increase the likelihood of keeping your license. Ben and Bill, anything else you think I should address before I sort of go over how to read a C of A? Because I don't want to get into the weeds of regulatory requirements.
Yeah, I'm going to share a bit more about good dispensing guidelines and the intersection of being a practitioner and running a dispensary, or how to audit a third-party dispensary you may work with. So share a bit about COAs.
Awesome. Let me share my screen and show you a sample C of A. This particular one is of Sazandra or Waita. And the thing what I would like to pull it properly is make sure that it has the right botanical source of the part plant and the plant. And it has a date, right? These dates are very important. Make sure they are still relevant. Has this lot number. Now, this lot number is very important because it allows us to trace the material to this, related to this C of A and the tests that have been done in it. The first section is different ways we confirm the identity of this herb. We follow the Chinese Pharmacopoeia, which is CP. The version is 2015. The 2020 version has came out, but the English edition only came out recently. So we'll be switching to 2020 standards in the near future. We've done microscopy, which is organoleptic, basically. Microscopy is really under the microscope. TLC is a chemical method. And these are some quality indices, and this is making sure that it's pharmacopoeial grade that our Sazandra meets at minimum level of greater than 0.4. Ours is at 1.6, which is roughly 4 times. Next area is heavy metals. These are the standards that it has to meet, and these are APA standards, American Herbal Product Association's recommended standards. And then these are the levels that we found in this product. As you can see, it's very low, which it should be, considering it's a fruit, right? It doesn't really accumulate heavy metals. This is a pesticide test, and this is screen. We're running the European Pharmacopoeia screen, which is virtually the same as the United States Pharmacopoeia screen. So that we didn't find any pesticides detected in this material. Next one is really microbiological, how clean it is. And because Sazandra is antimicrobial in nature already, the levels are very low without any treatment. So I think the key is really the lot number and making sure you understand what the supplier is testing for and if it meets the standards that they have set aside. And I want to share another document with you. It's the American Herbal Products Association's Food Allergen Labeling Consumer Protection Act for marketers of Chinese herbal products. And although you may not be marketing Chinese herbal products, the key is this document's great because it gives concrete examples of traditional Chinese ingredients that may contain allergens. So if you dispense certain things, they may have allergens in it, and be sure to read the packing slip or the packaging that you get the material in from your vendor or your supplier. For example, let me find an example. So in wheat is a common allergen. One thing is like something like this is Senchu mass fermentada. Well, we may not think of it having wheat in it, but it is that what it holds it together and makes those nice little bricks. So there is wheat usually in it, although it may not be obvious. So I think using this list is very important if you want to sort of just familiarize yourself with what are some ingredients that are allergens or may contain allergens that are used in traditional Chinese medicine. So this document will also be shared. The American Herbal Products Association has allowed me to share it with everyone attending this webinar. Usually you need to be a member to get a copy of this.
You're Wilson.
Yep.
I had a student come up to me years ago and said, someone gave me this patent medicine and they said it doesn't have gluten in it, but I'm really sensitive to gluten and I get sick every time I take it. And I looked at it and there was Shen Chu in it. The person who prescribed it didn't realize it had actual pieces of wheat. And that's pretty tiny amount in the patent medicine, but she was sensitive enough that she knew it was in there. She just couldn't figure out why they said it wasn't.
Yeah, and I think, traditional Chinese medicine has more of these ingredients than any other herbal tradition because we have a lot of different 泡制方法. So like when we 泡制 or, process these herbs to either increase its effectiveness or decrease toxicity, there's a lot of these things that only TCM does. And, Western herbalism or Ayurveda, none of them really do that kind of treatment that we do in traditional Chinese medicine. So I think that list is really essential to your point because people may not, they understand what it is, but they might not connect the dots that, oh, wait, there is wheat in this thing or whatever else it may be.
And you have to actually ask the supplier sometimes because I might get Chow Baiju. Well, is it processed with wheat? Because sometimes it's processed with earth, sometimes wheat. So you really got to call the supplier and ask, how is it chow?
Yes, it's definitely right. Somewhere like we no longer use a lot of wheat or other grains to chow. We just do a dry one, basically, which is acceptable as well because we want to reduce the likelihood or incidence or introduction of allergens, right? Even though when there is an allergen, we put it bright and clear and conspicuous, but how labels disappear and things fall off after it's been handled multiple times. So anytime we can reduce the likelihood of an incident, we try to do everything in our power to sort of reduce risk. And I think that's how we should look at when we use herbs and how we treat patients is also what is the least risky way to get to the results we want to get to. Sorry about that.
Yeah, I was just going to say, just so people hear it succinctly, this is the Food Allergen Labeling and Consumer Protection Act of 2004, affectionately known as FALCPA. And these major allergens are milk, egg, fish, crustacean shellfish, tree nuts, wheat, peanuts, and soybeans. And so as you saw what Wilson shared on the screen that you'll be having circulated to you, it's inclusive not just of those, but all the derivations of those, all the subsets under those.
And it needs to be updated because we have a 9th allergen added, sesame.
Mm-hmm. And latex is also something that is in some, at least APA recommended, consider like this may contain latex for people who have latex allergies. Dujong.
Dujong.
Yeah.
Yeah, another thing people should know is we already hear, Hosho, it's got to be processed in black bean to make it not laxative. But black bean in Chinese medicine means black soybeans.
And somebody asked a good question here. What about the likelihood of cross-contamination during processing or packaging? I can speak to that. In our facility, we there's required allergen control documentation. So if you're putting forth, when you see labels that say this is processed in a facility that also handles nuts and seeds, you'll see that in common foods. We do rigorous swiping and requirements for swabbing and sending out samples of surface areas if we process allergens, which you better believe our quality director says, how can we process as few allergens as possible now? So there's very rigorous requirements on how to mitigate that in the dietary supplement manufacturing environment.
Yeah, it is one of those things, like the number one reason for recalls is allergens and improper labeling or cross-contamination. So if you run a really good facility, you're always looking at ways you can reduce the risk of cross-contamination and having proper procedures and protocols in place. Back to Bill's original point, know thy vendor and know if they really are dotting the I's and crossing the T's to make sure none of this happens. For example, we do have allergens in our facility. We store them at the floor level away from everything else. So God forbid there's a little hole in the box. It will only leak to the floor. It won't leak down and contaminate everything underneath it. So go ahead, Ben, before I move on to the next fun topic.
Oh, yeah, lay it on us.
Adverse event reporting, or I should say serious adverse event reporting. So under CGMPs, current good manufacturing practices, both for food and for supplements, all companies are supposed to report, or not supposed to need to report, any severe adverse events relating to involving their products. So what that means is if there's a likelihood, cause sickness requiring hospitalization or death, you need to report it. And I'll give you some ridiculous examples. So this is what it means. This means you just have to report it. So if someone says, I found your vitamin C at a car crash scene, and the person went in the hospital and died. Well, what does my vitamin C have to do with a car crash and, physical trauma? But if it was brought to your attention as the brand that the person did end up in the hospital and they were using your products or had your products there, you would have to submit a severe adverse event report. You would get their, their age, sex, all these identifying fields, and then you would say they reported taking, Wilson's vitamin C, and then you would fill out they had a car crash and they got thrown out the window and they died, right? And then you have done your responsibility. It's not a causation thing. It's just if you were notified, you have to go report it. So I think, that's the event. Is not, no matter what, you have to report it as long as it's brought to your attention. Usually no one would ever bring it to your attention that your vitamin C or whatever product was at a helicopter crash or whatever it may be. But it is a good practice and there's a way to do it. And what I would do if I ever got notified of this as a doctor, I would take down the information and recommend that they call the brand or the supplier to report this incident. So you have done your duty to report to the brand and take any information that's within your required of you in your scope of practice. But as a product portion of it, you can push it down to the brand owner. And then there's things that are not severe, but it might be complaints. And we have to keep a record of those as well as brands of supplements and herbs. And you probably should keep one as well, just because good documentation will always keep you out of trouble. Because if everyone you give herb X from brand Y ends up with a tummy ache or something even more severe, well, you probably should stop giving that product to any patients you have and sort of see what's going on. And I think when we do these things, right, when we're dispensing or giving products or compounding within our own practice, record keeping is essential. Where do you get the product from? Roughly what lot you're using? Just so that you can have some way to sort of narrow the scope and understand the possibilities is, hey, this, if I used it over the summer of 2024, it probably came from Ben versus coming from Wilson, which I stopped buying from in 2023. Whatever the situation is, but at least you should be able to narrow that scope of focus in the products, right? It's really about, again, risk mitigation and be able to come back to a more finite view instead of saying, this could be anything I ever bought in the whole scope of my practice because I have no idea where this thing came from or when it came from, how old it is, how new it is. I just have no idea. That's when you don't want to get into that kind of situation.
Some feedback that I've gotten, I think as far as documentation goes, I don't know that there's an official requirement to document complaints or document side effects or adverse events for practitioners. I've been looking for that since the series started, but I do know that's a legal requirement for manufacturers of dietary supplements. And some of the feedback that we've heard is that when the FDA investigates you, which they will, not necessarily because there's a complaint, but because they're going to do an audit, they'll be concerned if you don't have a cache of complaints that you've investigated and documented in detail that you care enough to do an investigation. And so I take that and endorse and encourage practitioners to be considering, I need to apply critical thinking to what the causation is when somebody experiences adverse events and has a complaint. Not a serious adverse event, but an adverse event. And include that in your documentation. When part of this theme in this course series has been how to reduce the risk of claims and how to have a body of documentation that you can share or that can be audited in the event of some kind of investigation or lawsuit, heaven forbid. So,
yeah, I think, if you go back to my example, right? If every one of your patients you gave this formula to comes back with some kind of ailment and the same type of ailment, you want to be able to understand that as a practitioner. And if you go back to Bill's original documentation about the investigation, well, probably would be good to know whose product liability it would go under if there was really related to the product, right? You don't want to go the sense of, I have no idea what this product is and where it came from, and then it's going under your scope of malpractice insurance and any insurance you have because you can't point the finger anywhere else.
Yeah, I think that's really helpful information. Somebody asked, who would we report this to? And there is a FDA serious adverse events reporting portal. The information is in one of the documents we provided links to on the FDA's website. So if you haven't already got that, if you signed up more recently, that will be provided to you. We'll make sure that information is available to you. And so orient yourself to that. As far as serious, so some other fun things to me, we study with traditionalists and they'll say things to the effect of, and I appreciate this, I think it's a pillar of truth that's useful, with proper prescribing, there should never be discomfort or adverse events, so it's always on the responsibility of the physician. The superior physician doesn't elicit improper events, but I think we also want to take responsibility, use that as a guide rail ourselves, to take responsibility to understand that we may have errors in our proper Chinese differential diagnosis, and really understand what is drying what is overheating and how we may be influencing the individual's symptoms, and be doing an ongoing audit when we're eliciting discomfort or complaints. That it may not be a problem with the raw materials or the products, but it's actually, we could be doing a better job in instructing people how to take things or prescribing.
There was a
So-
local practitioner here years ago that gave Fudza, Ganjiang, Shishin, Mahuang to everyone. And there was a long trail of adverse events following this guy around. And he just had a belief system. He was prescribing according to his belief system, not what he saw in front of him. And that's why he had so many adverse events.
Yeah.
That's a belief system informed by a theoretical construct that, you know, at a certain zeitgeist became really sexy, and kind of just saw the same things with, you know, people doing medical qigong, and there'd be some charismatic teacher that people would follow, and, you know, everybody would have migraines and seizures, and this is amazing. On the other side of this seizure, I'm going to really be enlightened. You know, on the other side of the 60 grams of foods, I'm really going to work through my issues. So the other thing about serious adverse events and allergens at the intersection of those two foods, I've heard from 2 different quality directors of, you know, major dietary supplement or supplying companies that the only serious adverse events reports that they've ever had to write were related to chamomile.
Mhm.
And so chamomile, when you look, this is not part of the FOCPA requirement, but we see good actors, good companies, including disclosures related to the Asteraceae family, the sunflower daisy family that is in, and it will include dandelion, will include burdock, will include artemisias. Say, if you have any allergen known, consult with a doctor before drinking this tea that's on the shelf of every major grocery store chain. You know, the chamomile is not something that's going to be pulled immediately due to safety concerns, because it does have such a track record of safety, of common use, but there are individuals for whom it will create an anaphylactic scenario and create risk. So there's going to be an ongoing learning curve we need to be aware of, and the way that we can, like these big companies, be good actors. And this has been part of this series, you know, is really truthfully communicate to people known risks and document that, because that builds trust with your patients. And if you let people know that there might be a minor discomfort or a known risk, you know, you're going to be demonstrating that you care, and it's going to build trust and rapport.
Yeah, and I think, Ben and Bill, I'm not a practitioner. I just grew up around a bunch of them. So I can tell you how to treat anything, but I could tell you good practices of practitioners. I think, you know, also setting expectations is what it is very important when you see patients, and how you get, whether you get complaints about adverse events or not, right? For example, if you give someone rhubarb or dawang, you might want to just warn them. You may have some bowel movement due to this, and that's just normal, right? Or whatever that herb can do. So just set the guardrails, not guardrails, and be like, this could happen when you take this formula. So they don't think it's something abnormal, right? This is well within the power of this herb to do this thing. And if this thing does happen, don't be shocked, right? Or if it happens, call me, or whatever the situation is, but be very clear about what's going to happen, what the intended effects are, and what you should do if you see certain things, including stop taking it, right? These are all things that, as a practitioner, if you communicate clearly, it builds trust and authority and really reduces your risks, because now the patient understands, if I take this and I have bowel movements, don't freak out.
Perfect. Yeah. And one of our guests used the two simple words, managing expectations.
Mhm.
Uh, Having people understand what they're looking for. I'd like to take a little time to share a little bit more about good dispensing guidelines and practices and orient people to the American Herbal Products Association. Can I share my screen? Let's see, where is that? There it is. Do you see this? Do you see good dispensing practices?
Now we can.
Now you can, great. The origin of this document is a collective of, within American Herbal Products Association, which we've referenced several times, there are many working committees and working groups. And there is a Chinese herb committee. There's a sports supplements committee. There's a variety of committees that represent different subsets of the dietary supplement industries that use herbs. And so within the Chinese medical committee, there was for a long time a working group to create this document that was done in conjunction with NCCA. And so you can actually go get CEUs through NCCA. They have trainings that go into deep dive with good dispensing guidelines and give more examples and elucidate this document. It's open source. It's out there for you to see. The links were included and will be included in what we share. This is a really useful ongoing audit document for your own dispensing and compounding in your practice. And it's a really useful document for if you work with a third-party compounding and dispensing organization. And so Wilson mentioned some of the principles here, and I want to highlight a few that I think are really meaningful that relate to expectation management, clear communication, and different places where it's important to include documentation. This document sets a really high bar. Looking at labeling, inclusion of name, herbal formula, dose and strength, preparation date, name and address of healthcare practitioner, control number, and assigned beyond use date, if that's relevant. This may be more that can fit on the dispensing package. You may need to send a separate note in conjunction if you aspire to this label of labeling quality. You also will need compatible software or very good handwriting. And so I do see that some of the EHRs, electronic health records, that market to Chinese medical practitioners will have some labeling software included and may have integrations with dispensing software. There's been several dispensing softwares developed over the years. I feel comfortable sharing that we use LilySoft, aka Dispensary Tree, and it's very powerful and under ongoing development. And it's HIPAA compliant and supports compliance with a lot of these layers that can be daunting if you're not keeping digital records, and they're much, much easier than keeping your own documentation system. That's just one of several players out there in the dispensing software marketplace. We also want to include a complete list of ingredients, declaration of alcohol or other solvents, other additives or binders I would include in that. It's not uncommon, as Bill mentioned, use of, or one of you mentioned use of wheat as a binder in Shenchu, use of other excipients and binders in pills is not uncommon. So dispensing pills or granulated extracts, they're often more than the stated herbal ingredients. You want to include that. Also want to include possible side effects. So I'm not going to be exhaustive with this, but am going to go down to the differentiation of an herbal compounding record and a dispensing record. And these are things that can be maintained digitally, but keeping this traceability of all the layers of the cycle of preparation. This is differentiating. You may be compounding, as in a compounding pharmacy. You might be making 20 units of Sinisan or Xiaoyosan or Lijiangwan, whatever Chinese formula for ladder dispensing. And this is where it's in gray area of what is manufacturing versus dispensing upon a one-off consultation setting with a practitioner. But if you're compounding things for future dispensing, having this documentation, having this transparency, and having this traceability is really essential. So creating numeric codes, creating records of dates when things are compounded in a control number, such as a lot number and an assigned beyond use date, is an important layer. And the dispensing records that have the same data, name of the healthcare practitioner recommending the formula, name of the dispensing staff. So this might all be under one clinic with one practitioner. This may be a multiple practitioner clinic, or this might be a compounding and dispensing herbal pharmacy that is brick and mortar community based, such as you'll find in Chinatowns across America, or it might be under a roof herbal pharmacy that is shipping things out, drop shipping around the country. We talked about complaints and recalls already. Recallability is really essential if there is a contamination event. An example that we've experienced is one of our suppliers said, we did out of the multiple tons in our core sampling process, we found a small amount of what is potentially salmonella. They notified us that they had it in quarantine. They didn't give advice as to what to do. They just notified us that they had a potential contamination event. We knew to put that herb in question in quarantine and summon all the records of people who may have gotten that batch. We just happened to have an in-process batch. We hadn't sent anything, but they notified the FDA of everybody who'd gotten representative samples from that batch in commerce. And we got an unannounced visit from the FDA specific to that recall event. And they came in, they said, here I am, can I speak to your quality director? The representative sample was, and the in-process product was already in a quarantine zone because we responded. We were able to demonstrate that it hadn't gone out into commerce. And they said, great, send us your test results when you get them. We sent them, they said, thank you. We never heard from again. And it was determined that the specific botanical did not have a major contamination event with salmonella. It was all cleared for commerce. Our sample was cleared for commerce via testing. They cleared theirs. But that chain of custody documentation ought to transmit to your dispensing, because if that level of event happens, you want to be able to know where you received your raw materials from, keep those lot numbers, keep records of the lot numbers that come into your facility or clinic. If you're using a good dispensary software, you should be able to keep records of the lot numbers of the individual ingredients that are coming in and have that part of your ongoing inventory management system, bringing those in and expunging those when they're no longer in circulation in your system. So this is very mature, detail-oriented stuff. It's a lot to ask individual practitioners. It's really important that you attend to this and abide by it. We're trying to present examples that do seriously articulate the risks involved. And so there's recommendations here for recall procedures, including awareness of factors which necessitate a recall, personnel responsible for a recall, and notification protocols, including notification to the FDA which I just shared an example of. So do you have a mechanism to contact all individuals who have or could have obtained compounded herbal formula from the operation in question? I hope everybody kicks up the seriousness of that a notch. So those are some salient things that I want to highlight. A lot of this, the rest of this document, which you'll have access to, you have access to, you have a link to drills into hygiene and the type of record keeping that you ought to maintain and uphold. This is GMPs light, but it's GMPs that we believe that practitioners ought to be attuned to and understand the associated risks that inform why we do this. There have been a couple episodes of other deaths related to Chinese herb dispensing. There was multiple deaths related to foods contamination in San Francisco in a Chinese herbal pharmacy. What was that, 5 or 6 years ago? The health department got involved. The results weren't necessarily released to the public in a super visible way. The outcome exactly, I don't remember, but the result was not foods are being made illegal. It did highlight good record keeping, good documentation, good compartmentalization of herbs that might have an elevated risk, and also really crystal clear knowing and vetting your suppliers, especially when it comes to potentially higher risk materials. The news that was created by the mulberry leaf poisoning that happened recently, I think may have had some weight loss and other issues involved, that it was somebody sourcing a mulberry leaf weight loss product on the internet and potentially having some other cofactors, but there was a big press release around it, and it didn't have China the way the foods the issue did. Do you have any thoughts about that, Taylor Wilson?
Yes, I do. If you look at the fact pattern under that, it is very strange, right? And it is important to keep your potentially hazardous or dangerous herbs really separated from any other of your normal herbs, because just like how we keep our allergenic material on the very bottom, you want to reduce the risk of any possibility of it falling into or being cross-contaminated or ending up in some other drawer when it was dispensed. So, if you look at the fact pattern, that could be one possibility, or just could have been the herb was improperly mislabeled or whatnot. But there's a lot of possibilities in that particular case. But I think the one thing we can learn is put your toxic herbs elsewhere so that you don't ever risk the chance of someone accidentally knocking it over and contaminating a bunch of your herbs with that toxic herb in question.
I think in this case, they got a formula. I know at least in one case that there was a death, but the formula didn't have foods in it. So somehow it got unprocessed foods, which is very high in aconitine. And the mulberry leaf thing, that was just a fiasco. There was no causality assessment, just some really, really poor investigation by the medical examiner. They basically found a tiny piece of mulberry leaf in her vomit, and somehow mulberry leaf was the cause of the problem, but it's completely non-toxic. It was just a false accusation of the mulberry leaf.
With a good PR director.
Yeah. I have a question for Wilson. I've been answering some questions in the Q&A, but one person asked about how do you know if how do you assess the quality of the lab that writes the C of A? And from my perspective, I just know the good labs. And if I buy something for a client, I just retest it at one of the good labs like Alchemist or Flora or Eurofins. But could you answer that, Wilson? How do they assess the quality of a lab when they get a C of A?
Yeah, I think what you want to know is from your vendors which labs they're using, and are they ISO accredited, right? So it's just like if they've gone through the ISO accreditation, usually that means that at least they're doing, the minimum that you would expect of a high quality lab. And if they're not ISO accredited, you really have to ask, why aren't they? Why didn't they go through that? Are they too small of a lab? Was it too costly for them, etc.? And we always use ISO accredited labs because to us it's important to have a second set of eyes in addition to our own and what we know about testing and whatnot, really to make sure that it's up to snuff. And also these audits are annual audits, so they're going through it year over year over year over year.
And if there's a suspicious C of A, you could always call the lab and say, did you actually do this C of A, or is it faked by someone? So if they didn't actually do it, you already know that it's not valid.
Yeah, I think the key really is, trust but verify. But I think what you want to do is verify, are they using the right players and the right facilities and doing the right things versus like trying to dig really into the weeds, because that will take a lot of time and may not yield a lot of benefit.
Okay. Let's focus on question and answer. Any other questions that people would like to focus on? Should we all have more things that we can talk about?
There's some good questions in the Q&A. Somebody asked, are there contraindications for herbs, some conditions, or some patients with prescription drugs that are clearly out of bounds legally? Seizure history or prior aortic vessel replacement, for example. I think legally, I don't think there's laws that dictate that. I think that, this is where we're implored to really, one, be versed in enough Western medicine and Western pharmacology, and or have relationships with both Chinese medical practitioners who are, and really build bridges and relationships with Western medical practitioners. And I think as Wilson articulated about his grandmother, physicians are trained in China to be exceptional Western physicians and exceptional herbalists. Very often the specialty, if you've spent time in China studying hospitals, you get to see representatives of that. Somebody who is the hypertension specialist who's focused on hypertension for 40 years and writes 100 prescriptions a day for herbs for hypertension and related conditions. It's really mind-bending, and I don't think we touch anything like that in the practice of herbal medicine in the West. And so if you have that level of expertise, you may be an excellent person to be able to recommend herbs along with somebody's aortic vessel replacement or seizure history. But if that's not your training, that's not where you have mentorship. There's a really smart comment here from Doc Mitchell about mentorship. If you don't have good mentors and you don't have the guide rail of relationships with Western medical practitioners that can support you in having proper monitoring of those conditions, then it creates more risk than if you do have those kind of relationships set up and literacy yourself to be observing what is the role of herbal medicine in shaping this.
I can address
as far as seizures go. there's a lot of literature about use of herbs concurrently with seizure medication.
I can address that comment about the aortic replacement. When there's a replacement organ, of course, they're taking anti-rejection drugs. In some cases, tonifying herbs have been known to actually strengthen the immune system and be possibly behind a rejection. So it's an individual basis. Like, for example, cyclosporin is given, very toxic drug is given to people with kidney transplant. In that case, you can give them cordyceps. There's lots of clinical studies that shows that it actually can help prevent rejection and lower the toxicity of the drug. But you have to be very careful with organ transplants because in some cases, a tonifying herb might induce a rejection.
Somebody asked, can we get specific guidance about dispensing from our clinics? I would look to NCCOM's, broader elucidated training on good dispensing guidelines.
Yeah, you can get CEUs for that, and it's actually a very good course.
So people are asking about specific companies, and I think it's inappropriate for us to offer our opinions about them, but all of the companies I'm seeing mentioned are very established, high-level GMP, made in China companies. I think that's a good thing to be asking, is this made in an ISO certified international facility, which is very commonly the case, or if it's manufactured in the United States. A leading question I might ask is this an FDA registered company? Because that's going to be a tip-off of, are they following guidelines? Do they have processes and procedures for traceability and documentation? Because I do think there are people selling things on the internet that are still making them in the garages. And I don't think that's inherently evil. But I do think you want to know that and understand how that liability or probable lack of product liability insurance impacts the risk to you if something goes wrong using those products.
What to speak of counterfeit products on Amazon that look exactly like the original manufactured product. I just tell people don't buy herbs on Amazon.
Mhm. Oh, I think having like the bare minimum is a facility registered with the FDA. Do you have product liability insurance? Do you follow GMPs? If you ask those basic questions, you should be able to weed out a lot of the bad actors if they answer it honestly.
This is an interesting, can we give away formulas that are expired to patients? I was taught, perhaps wrongly, that it's fine to give them as long as you do not charge for them. What do you guys think of that?
Oh, do you want me to answer that?
Yeah.
I'll put it this way. This is what I would say is, look, you're introducing it to that patient. So even if you don't have product liability, you still have liability under your scope of practice. Do you want that hanging over your head?
This is the licensed attorney not giving legal advice, but he's giving very prudent advice.
It's not legal advice. It's just a question.
What do you think, Bill?
I didn't hear the entire question.
The question is, can we give away expired formulas to patients? It says, I was taught, perhaps wrongly, that it's fine to give them as long as you do not charge for them.
I do if it's only expired by a month or two and I don't charge. But as Wilson says, I'm just as liable for that as for one that I sell. But I won't give them something that's expired for a long time. And I only do it with patients that I know. But yeah, I mean, if you want to be really, I throw out a lot of stuff that expires on the shelf, so that's just the way it goes.
Yeah, it really is the way it goes, right? It's one of those things that you have to think about this way. You accepted money. Well, where does, whether you charge them or not, you already got the money. So think about that.
You're having a transactional relationship with them.
I don't have a problem with the patient is really, really broke and it's expired a month ago. I don't have a problem with that. But I tell them it's expired before I don't charge them.
Mhm.
One question here, can we discuss added liability or not regarding custom herbal prescriptions in contrast to finished products, I assume is part of that question. My hunch is, there's a triangulation between what is written policy for a insurance broker, because when we talk about liability, we're talking about liability coverage as well as, we could talk about the liability of the patient getting better or not, but I think we're talking about risk. And so if we're talking about coverage, there's that risk. And then to what degree is it as easy to prove causality if you've compounded something? Is just a rhetorical question I have.
I think it's not so much causality, right, Ben? It's really about when you compound something, you have two components to it. One is the product itself. Have you made it in a safe manner? Right? That's one aspect, right? Assuming you did. The second aspect is, did you put the formula in a way that is responsible and safe? And when you have bought it from a brand, they have taken that risk and liability on so that when I put together Shayawan, I put it in a way that is safe, right? As a formula. And then the second thing that I've done is I've done it in a manner that follows the CGMPs, tests all the incoming material, the finished product, etc. So I'm controlling for both of those elements, right? Whereas you may be putting yourself at risk of both of those elements when you compound. And I don't want to discourage anyone from compounding. My dad's been running basically a herbal compounding pharmacy for the last 45 years. So I think there's plenty of safe ways to do it, but you do increase liability versus giving someone a closed bottle that's been sealed when that liability really is going to Ben and Five Flavor Herbs because he's put together this tincture.
Yeah, and if you're putting together granular formulas yourself, you're compounding. You're touching something, it's open, it's exposed to the air, to germs. So you better have a spotlessly clean place to put those together and follow good practices. It's why I don't put together custom granular formulas in my clinic because I don't have a space with a sink. The sink is next door in the bathroom. I'm not going to wash equipment in there. So if I want to make a custom granular formula, I just order it from one of the online compounding places. But if you're worried about liability from adverse events, you have to be prepared to justify the formula, whether it doesn't have to be in Western terms, but here's why I put this in, here's why I put that in, here's the logic behind this, and provide some documentation.
And the whole conversation of good dispensing practices is the way to mitigate liability and risk through documentation practices, through hygiene practices, through traceability practices. The other part of the thing that would triangulate to help answer that question that I don't think we have a lot of information about is what case law exists. And my guess is very little. But the FUDSA example that was made is, to what degree are you increasing liability moving to compounding and dispensing? If there is errant FUDSA contaminating a batch of a formula that was not scripted with FUDSA and somebody dies, that's what can go wrong if you're not following these practices. So that's a resounding yes. It can increase liability.
Yeah, I think it is a matrix of risk, right? And the less risks you take, the lower your liability is. I mean, that's all it comes down to, liability, right? Is you want to minimize the risks, and the more risks you take out of the equation, the less liability you have, exposure liability.
And I don't want to demonize FUDSA. I use lots of FUDSA, Mahuang. I don't use Shishin anymore, but it's not the FUDSA. If it's properly processed, properly prescribed, you shouldn't expect side effects. If it's improperly processed, you should absolutely expect side effects. If it's improperly prescribed, you're going to get side effects due to its extreme heat generating properties. But good quality FUDSA itself is not toxic.
Well, somebody asked, if a patient is using alcohol that can interact with herbs, what is best practice? Withhold herb, do not dispense, document patient, educate warnings against use of alcohol concurrent with herbs. I think we're talking about substance use and substances of abuse or use in general. We want to educate people about their impact on their therapeutic goals. I think this fits in with management of expectations of, if you are using these herbs and continue to drink, you're going to, maybe get 25% of the benefit. But if you want to keep drinking, there's also the harm reduction framework of, we might be able to support people in having more comfort, more vitality, etc. And reduce risk of liver damage with herbs if they're using alcohol. What do you think of that, Bill?
Well, the main problem, of course, if they're an active alcoholic, it's a problem because their liver's already impaired and normal metabolizing of herbs could be impaired. But to me, the biggest issue is if you have a recovering alcoholic, do not ever give them a tincture, even if something may be called alcohol-free. Alcohol-free by definition can still have 0.5% alcohol. I had a patient who's dead now, probably due to a drug overdose. She was on the wagon, and a practitioner, not an acupuncturist, another practitioner gave her a tincture, and she immediately started drinking again. So if their brain detects just a molecule of alcohol, it's possible they're going to go back to drinking. So be really, really careful about that.
I have a question for you too. What do you think about the legality of, claims on dispensed products? These are not, are they or are they not dietary supplements? If it is within our scope of practice as a Chinese medical practitioner to treat anxiety or, a disease, arthritis, and we write that on a bottle that we're prescribing to somebody, is that a claim that is violating GMPs?
Well, it's not necessarily GMPs, but FDA rules. But we can do a lot of things with our patients. But if you put something out for sale on the market, then you're in big trouble with making claims like that. But just in general, like I do a lot of custom formulas for things like psoriasis, ulcerative colitis. I just put the title of the formula, healthy skin, healthy bowel. You don't need to put a disease name on the label. But the main distinction is we can talk about disease with our patients one-on-one because we're practitioners, at least in California. Every state's a little different. But if as soon as you take a formula, oh, this one's great, everyone loves it, I'm going to sell it online or I'm going to put it on a retail shelf, then you have the same restrictions as any manufacturer. You can't make claims like that.
I agree with Bill, right? Is that you have a lot of discretion as a practitioner and within your scope of practice and what you can say and can't say. But the second you start writing it on things, then circulating it, right? That's where the issue becomes, right?
Mhm.
Like, if I wouldn't recommend anyone to write it on the bottle, first of all. But if you were to, and you give it to one patient, what is the likelihood of that ever coming to a violation, right? But I wouldn't recommend doing it, but you have to really think about risk or reward. You know, what is the right way to do it, right? Like to Bill, like you still want to be able to know it's good for healthy bowel movement. You want to give them some hints what it is for. You can't just give them from say just take it and be happy with it either. So I think, you know, there is that balancing, right? It's like you have this enforcement discretion, but make sure you're not compounding or do anything like that.
One great question that I'll answer really quickly, and then we'll wind things down. Recommend an online quick reference for cautions and contraindications for drug herb formula supplements. A lot of people are on a lot of things these days. Earlier in this, Misha Cohen, thank you, Misha. Hi, Misha. Suggested Natural Medicine Comprehensive Database as a resource that she refers to. Do you have anything else, Bill, that you really appreciate?
Well, the
Refer to on a
Botanical
regular basis?
Safety Handbook, but the Botanical Safety Handbook, the print version is 11 years old, and the online version, you do have to get a subscription. But it's very comprehensive. Basically, when I'm doing a entry or a revision, I do a complete literature search. So for things like ginger, I'm looking at a couple of thousand studies. For turkey tail, similar. So any adverse event, we report it, we give the details, any mitigating circumstances, you know, like there was no actual study on causality, or there was, and they rated it as probable. But once again, that's you need I think it's like $90 per year for the subscription.
Hmm.
Book is similar price, but the current one is fairly out of date.
As far as supplements go, a lot of the big, like Memorial Sloan Kettering will have a very thorough database that they are continually updating. Some of the big cancer centers, MD Anderson, these big medical organizations that are playing in the integrative medical space have taken it upon themselves to make more of this information available. You can also look at National Institute of Health will publish literature, and there's really an increasingly inordinate amount of information coming up that can really deep dive into any one of these subsets of contraindications, risks of combination with medications.
Misha just commented that the natural medicine database is updated daily. Costs a bit more. How much is it, Misha? I don't know if she heard me. Oh,
Um,
$199 per year.
Thank you. Anne Marie, do you have any closing remarks? There's a link to the continuing education request form in the link here. This is the last of 4 really valuable recordings or live presentations that will now be a recording that will continue to be open source, and encourage you to share these with your peers and your colleagues. It's been our intention to, I think it was last year at Pacific Symposium, Anne-Marie and I said, okay, what kind of contribution can we make to our profession? And the culmination was this series. I hope that we do some more, maybe do some more deep dives.
Yeah.
Really appreciate Bill and Wilson showing up and sharing their expertise and experience. Any closing remarks, anybody?
Yeah, I have a few slides I want to go over to wrap this up. Let me share my screen. Okay, so I did put the link in the chat, but for those of you who haven't seen it, you can get your CEUs by filling out the form. The web address is basically the one that you've been using for everything to get the Zoom link. There's several different buttons there, so just click that button to get your CEUs. We are offering NCC AOM and the California Acupuncture Board 2 credits live. Credits only, distance credits unfortunately are not available. You must be present for the majority of the webinar. Please allow 2 to 4 weeks for processing. It's been taking about 7 to 10 days, but we are doing it manually. So bear with us as we get that taken care of as fast as possible. If you do have any questions, feel free to email me at info@miec.com. As been mentioned, this is the 3rd webinar in a series that we created called Pointing to Safety. And all 3, the recordings and the materials for all 3 of them are open source. They are on the website. So miec.com, AcuSafety Panels will get you there. And there's a number of links you can go through to find all the information. There's handouts, materials, links to the guidelines, adverse reaction reporting, including one for acupuncture that was discussed in a previous panel. And there is also links to connect with all of our sponsors. Additional herb resources for you. Obviously, there are the handouts that you already have access to. I encourage you to check out 5 Flavors Herbs as well as New Herbs for other resources that they have available. And Ben also has other educational classes available on his website. And then in panels 1 and 2, we discussed more about malpractice claims as well as risk management for acupuncturists. There are some other safety and ethic training opportunities for you. Anthony Vandermoel and Lisa Roadletter, who were panelists in the previous panels, previous webinars, have some classes that are offered. So I really encourage you to check those out. I did take the first webinar in Anthony's Avoiding Lawsuits class, and it was very thorough, went over standard of care as well as just endless amounts of other information. I highly recommend it. And again, I want to thank our sponsors. We really couldn't have done this without you. They helped us get the word out so we could reach as many people as possible. We wanted to get all of this really important information that we felt like wasn't being discussed in the continuing education space. There are bonuses that several of the sponsors have available, like discounts to their classes or discounts to herbs. So please check out the handout on the handout page. And then you'll also notice on the web page that there is a button for a course evaluation. I encourage you to fill that out. This is a pilot program, and if we get, we're basing the possibility of doing more based on the feedback that we get from you. So please take just a few moments. It probably takes about a minute to fill it out. So thank you for that. And that is it. Thank you so much, everyone, for attending. We really appreciate you being here and being a part of the profession.